Hello, everyone. Welcome back to the webinar. We hope you enjoyed meeting colleagues from around the world and had enriching and thought-provoking conversations in your breakout rooms. Before we report back with a summary of the action items and discussions, we're excited to introduce our last speaker, Dr. Soendoro, who will speak from an ethics lens about reimagining a decolonized global health. Dr. Triono Soendoro is the current chair of Indonesia Research Ethics Committee. He's been a national leader in health in Indonesia and many countries in many capacities over the past 2 decades, serving as Director General of the National Institutes for Health Research and many other leadership roles in the Ministry of Health. He institutionalized leadership training in the Ministry of Health and in public health curricula of 6 Indonesian universities. In addition, Dr. Soendoro has a wealth of experience with various international donor agencies and is very well versed in global health ethics and systems. Thank you so much for joining us today, Dr. Soendoro. We're incredibly excited to have you. I will turn it over to you now.
Thank you. Let me check my screen first. Okay. Good afternoon, everyone. Thank you for inviting me in the last sessions. As assigned by the organizing committee, I have my assignment is talking about the global health ethics, reimagining a decolonized field of the global health. There are 4 session objectives. That's about global health and decolonized thinking, designing a solution, so creating change. What are the 3 core values for ethical research compass on COVID-19, and how we manage the change and showing the commitment. Now, briefly, let me talk about the number 1. The learning objective, put it 3, to learn how to use what we already know, how to realize what we do not know, and how to learn what we need to know. To synthesize separate findings into coherent whole using the principles of systems thinking. To generate information from different perspectives. And lastly, to understand the concept and strategies of developing an ethical compass during pandemic COVID-19 in a multicultural context in research activities.
Hi, Dr. Soendoro.
Oh, yes.
I'm sorry to interrupt. We were just going to ask, we aren't able to see your screen shared. Are you able to share your screen? If not, I'm happy to share it for you.
I put a screen share actually. Can you see it?
We're not able to see it.
Okay, let me see it. Can you see it now?
Yes, thank you very much.
Oh, okay. Okay, there are 3 learning objectives. That's number 1, to learn how to use what we already know, how to realize what we do not know, and lastly is to understand the concept and strategies developing an ethical compass during pandemic COVID in multicultural context in research activities. Now, let me go to the what do we mean by colonialize and decolonialize? As perhaps earlier was outlined and detailed description by the previous speaker, I just outlined the several of them. Based on the studies identified an analytical gaps previously, role of medical education in the context of colonial North-South relations. That can mean reversing immediate legacies. Colonialism lacks investment in health system, robust system research institution in former colonies. Can also mean dismantling global health that often stand in for the system of international institutions and donor that govern the public agenda and control level of power. Lastly, where health interventions imposed on low-income communities, neo-colonialist colonial influence is more obvious. Now, allow me to give you one pictures or graph diagrams about how the observers look from these angles. The observer 1 when this person is asking why, what, and how, other persons looking differently. Why and what and how from this angle, improving the appearance of the properties. Someone, the observer one, asking what, but the other observers looking why. So the choice of level is depend on the observers. Like in the context of colonialize and decolonialize. So there are so many perspectives, depend on who is describing and who is elaborating that kind of way of thinking. This is just to show you how so important in looking in that perspective. Now, we are in the era of COVIDs. Allow me to talk about and what we learned from the Ebola 2014 and the Lancet journal series in 2017, and just this year, early or end of 2019. What about the compass ethic that described by Neufeld and his friends? Okay. What happened with this? Oh, sorry. Oops. Okay. Now, in the Ebola 2014 and Lancet 2017, there was one explore about the research ethics questions in reference to the various type of global health and health emergency throughout the world, the valuable role of research in the context of outbreak, the evidence base for vaccine therapy effective, and now in the world more than 150 is delivered. I'm just bringing to the context of the COVID itself. And lastly is the lack of consensus on how research conducted to be done ethically. Now, allow me to talk about global health from the epidemiological perspective. You can read this as several things. I don't need to read one by one, but there are the definition, the understanding, characterized as health issues, and lastly, the ways in which ethical concerns in these various fields have been analyzed and codified, including significant differences and approach. So there are three global issues, three issues on that. Number one is the community engagement. Number two, access to basic care. Number three is the frontline worker welfare emerge. The challenge seems different. Countries with relatively developed health services, good research capacity, and political systems allow for extraordinary speedy building of new health facilities and deployments of health and military personnel, for instance. But the longer outbreak continues, as what we have experienced now, more clearly parallels emerge with recent outbreaks in the country with much weaker health and research system. So lesson learned from this, there is no ideal circumstances characterized by disruptions, uncertainty, great health needs, compounded by competing claims for legitimacy, time pressure, confusion, and distress. Ethics help us navigate the gray area between absolute right and morally wrong. They provide the structures that help us make decisions we can proud of. Now, let me move to the second sessions. How we design the solution, how we create change. About the, in terms of the colonize and decolonize itself in the context of COVID. Now, in creating change, allow me to use the what Jamshid said in 1999. He wrote a book that I like that book. If we would like to design the change, what do you have to do? Defining the problems, the opportunities, and how from the define the problem, we then coming up with what we call the designing the solutions. But if you look on the left side, there are two parts, the system dimensions and the system principles. Now we are talking about the system thinking, how people from different angle, the way the question raised from observer 1 and the other one from the observer 2, how we communicate and then understand that we are all one actually. There are 5 system principles. Number 1 is the openness, purposefulness, emerging properties, multi-dimension encounter, intuition, all system dimension, the 10 elements, the system dimension and system principles are all important then to put in the context of designing solutions. That is why the level of output is how we come up with this and then eventually bringing the change. But in order to do that, we have to understand what do we mean by purposeful. Purposefulness is about the choice, depend of nationality, emotion, and culture, and is the primary idea behind these principles. There are rational, there are emotional, and there are cultures. Attempts to understand purpose are attempts to understand why systems behave the way they do. Purposeful system can change their ends. They can refer one future or another, whether the environment changes or not. This idea foreshadowing as basic, what called it, working principle of design. When we design, we assume the system is right, but actually that is not. Because in the decision making, there are 3, according to what called from Jamshid, is EIKU, informations, and then knowledge, and then understanding. This depends on the 3 rational, culture, and emotions. So the conflict about thinking, about what you have been working throughout the day from this morning, is how we can influence other people to understand. The question is about the last one is, why am I behaving like this? Why? Because the knowledge I understand and receiving the informations, and then we can make change based on that. Then we come up with what we call the multidimensionality. Usually, people are talking about who is the winner, who is the losers, winning and losing. There are 2 words, and not all. Usually, if you are not with me, you are not my friend, or you are people or differently. But the words and, meaning we sit together, you and I. So the ability to see complementary relation in opposing tendencies and to create visible whole with unvisible parts, bringing us to the continuum. There is no black and white. There is a compromise. How can we understand from different perspectives? Okay, the multidimensional is one of the principles of a system that I just described earlier. So if we understand this, then how we come up to the one of the 4 a block of this? If we become mature, the person is mature, then we are coming in this box. But if we are very, very low energy, I'm becoming this one. The concern of change really depends on what called the multidimensionality of behavior, thinking of people facing towards the change itself. Now, let me move to this 3rd section. The 3 core value that ethical research compass use from the learn in the past. As I mentioned earlier, the 3 core values of ethical research compass is described in end of 2019 or early 2020. There are 3 words, the ethical compass. Number 1 is about the fairness, how we reduce suffering, and the equal respect. This is written by a team of Newfield Council, and I would recommend you to read this dimension and how the worlds come together based on the earlier what happened in Ebola in Africa, etc., and make people aware. Question number 1, how we help reducing suffering? Thinking how the best is it? because this is it provides the primary justification for research to take place in all such cases. It provides a constraint on what research should be considered. Never research for research's sake, and guidance on what research should be prioritized. The question then, whose needs are being met by this research? Who has defined the researches? Are these most important needs? The same thing as also fairness. How we can distribute the benefit and burden of research equitably. And lastly is how we can demonstrate that is have a moral equal and everyone has the same principles, that everyone was important. The poor, the West, the other people in the world that is not from the developed to developing nation, but all inclusive. Now, okay. One thing about ethical approval. Ethical approval not living in a vacuum space. Considering of the ethical application of research rather than being a vacuum without referring to the specific context of emergency, as revealed at certain times and locations. And in connection with structural issues, there are two things about the context of emergencies. Okay, in connection with structural issues, politics and broader authority, and as revealed at certain times and locations. Okay, now we have heard in several months earlier, the word of solidarity come into place. WSOs in March or February launching the solidarity trial, whether this is for treatment or whether this is for vaccines. Solidarity means an interactions. The assumption the new system represents desire or explicit choices by the designate, long as they support by wise political decisions. The behavior of people in the field, the function of the processes is a change and the front lines opportunity so that they are directly involved in this system, they becoming the ownership. So I'm from Indonesia, and Indonesia has joined the solidarity trial and the vaccines in April with other countries in the world, for all of the world, from the Africa, from South America, as we are joining all together with the umbrella of solidarity. While UK have joined what they called by what they call discovery in France, and I forget the name of the in UK, but I will go that in that part. One thing, no boundary, no colonized thinking, focusing all on the combating the pandemic. That is important. Okay, because we are talking about reimagining. This is not reimagining. This is real. The fact, the world has changed. And the COVID pushes us toward that solidarity. Okay, now, the cohesiveness and commitment from March 13, March 17, and then March 22, and then March 30, Indonesia joined the solidarity, and then UK with recovery, April 6. Thousands of people who suffered from diseases all over the places, all over countries, have been treated focusedly, and the commitment by many scientists who joined thinking with the umbrella of solidarity. Okay, the principal high-risk patients as the primary care was considered as the most priority one. Recovery in hospital trial, etc. So you can look into the journal, many information about how this is done in many parts of the countries. Only 4 therapies, 4 types. You could read this by 4 types: standard of care, and then remdesivir, lopinavir, and ritonavir, etc., hydrochloride, etc. But I'm not going to that part. Just skipping. just to show you how the commitment is working. Now, the final sessions. How we manage that? How people in the world, countries, showing their commitment. Earlier, I just mentioned in the third sessions, the evidence of the word of solidarity in combating the COVID, including Indonesia, and I believe including many countries in the world. We can hear from the news, from television, etc. We are still suffering from that diseases. Okay, now the word novelty and cohesiveness occurs. Scientific, ethical, medical, who is very rare, very fast. All of a sudden, the world come to unity. There is no more boundary among countries, although some are still there, but the majority are concerned about this. Recruitments, innovation of combinations, a remarkable change, the superiority of individual or institutions or country, the shift to become a collective actions to conquer the pandemics. Never before we have shown and this kind of thing happened because it suffered the whole people in the world. In difference with the pandemic earlier in Indonesia, for instance, in 2007, when I was the DG of NISRD, for 4 years, I have been putting in the, I had been sitting on the hot seat, combating the bird flu. At that time, only Indonesia, Vietnam, and several countries, Southeast Asians, with the bird flu H5N1. But now, with COVID, all over places in the world. Okay? Then, the evidence of creativity. That's why the ethical compass that was developed, raised, and coming up based on the Ebola evidence in 2014, now in place and being used to combat for the COVID. It is not just a slogan, an implementable thing, and we are watching, and we are the people who are also doing this. I call it, this is a novelty, a real things in the world that is happening. But the problem, are we failed? Or still we are fighting the process in order to become, to make it happen? It is not just one-time decisions. It's going to take long. Okay. We have been living so far through the fragmented, how to become unity. As mentioned earlier in the 7th slide about the what the Jamshid mentions, the organization behavior does not display and what each part does, not a functions of component, but how to function a combined pieces in order to understand the whole. So living in a whole, shifting from the natural part thought to become the whole, meaning living in a whole that is in the whole. So there is no more boundary. Okay. Now, is this reimagining? No, it is real. Real communication, especially with the technology now, we can communicate through Zoom, and everyone today is talking each other, physician, people in every part of the world, they have been communicating. That is towards unity. Okay, real. Now, how can we face this? A failure in solidarity in 2018. We had that kind of, and this is a global disease as well. This is a global health. What is that? About tuberculosis. Why tuberculosis is still there? Why COVID? Making people all together. You can read in the article, the failure in solidarity in 2018. And there is an article, a very good article. Why? Because solidarity allows us to better understand and address the ethical challenge that reigns in intensified development and implementation of new tuberculosis technologies, decades of the disease, but still there. But where is the solidarity? Solidarity lends credence to policies and practices that address the relationship nature of illness health throughout the collective action. The collective action is just a words. The disease is still there. Look, this picture, it seems fragmentations, independence variable. The type 1. It really should be the type 2 that is interdependent. And that is the emergent properties. Emergent properties means produced by the interactions, not the sum of the part like this one. Think about chemistries of combination and mixtures for a simple examples like in these pictures. A sodium and chlorine combine to produce salt, new compound with unique properties. We are moving towards this, but still people are still thinking as natrium, sodium, or as chloride. COVID almost become the solidarity to become salt in terms of the chemistry, but tuberculosis is still dominating by part. The final slides, I'd like to bring the late David Bohm. What we are missing and we need to fight to continue in our life is the dialogue. Nobody is trying to win. Everybody wins if anybody wins. So that 3 words, points, I like to cite it. The scientist is engaged in similar dialogue, nature and his fellow as a human being. When a scientist has an idea tested by observer consideration of the similarity and different, he gets a new idea, which in turn tested. With the continual emergence of something new, common thought of scientists observe in nature. And that is the assignment of how we change. And I hope the presentation of the 4 sessions can bring you to more understand how it's so important to see from different perspectives through a dialogue. Thank you. I hope this is benefits. I finished my presentation, Sarah.
Thank you very much, Dr. Soendoro, for sharing your wisdom and time with us. We deeply appreciate it. We have a few minutes, and so we're going to open it up to the audience. If anyone has a question, we have time for probably 1 or 2 questions for Dr. Soendoro. Feel free to type it in the Q&A box if any questions arise.
Okay.
Okay, so we have our first question. And this question is, how can we convince people who hold power in global health that decolonizing global health will be beneficial for everyone?
How can we convince the people that hold the power dynamics that decolonizing global health will be beneficial for everyone? Very good questions. I explained earlier. Look, the key is dialogue, not a debate. Holding one positions, or we come up to understanding. Dialogue, there's no one is winning. Everyone has to listen. what other people talking. Of course, again, my slide earlier about an observers number one and observer number two, talking from different angle of what their mind have. That is Singy calls, Peter Singh is mental models, the perceptions. And when you stick in that perception without listening and having a judgment, it's very hard. Behind that, is it ethical to hold your way of thinking without learning or listening to what from different others people mind of thinking? That is the most important one towards unity, by not saying you or me or you, but you and I. The word "and" is the most important one. Okay, I hope this is clear, and it's very, very difficult, but it shows that COVID can bring people because of that. But if COVID is finished, what about tuberculosis? Tuberculosis is still there. So the I, K, and U, informations, knowledge, and understand why is the most important things. I hope this is more philosophical, but we need to understand about how people are thinking in that way. Thank you, Sarah.
Thank you very much, Dr. Soendoro. We deeply appreciate your time and your wisdom that you've shared with us, and you've given us an inspiring talk. We will now pass it over to Noma to conclude.
Any other questions?
Thank you, Dr. Soendoro. I think those are all the questions that we had for you.
Okay. Yeah. Can I leave now or continue?
Oh, we're about to. You can feel free to leave, or you can stick around for the last bits of the conference.
Okay. So thank you for listening, and I hope it's useful. And thank you all, and good luck.
Thank you very much for joining us. All right. So to conclude the conference, we have compiled the main points from the breakout rooms discussions to share. Franny, you can go on to the next slide. Oh, thank you. So the key takeaways from our workshops include from the health systems workshops, we have that there's a lack of attention to successes in LMICs. And so there's a need for better reporting of successes and more inclusive knowledge sharing. We need to empower others to effect change. And there's a call for more advocacy training. So training people to be effective advocates for their own country. And someone suggested the model of training the trainers. So you train the trainers to train people so that they can advocate for themselves and for their communities. And then we also have that people in leadership from impacted countries need to be at the table and fully included in conversations regarding their communities. And lastly, for health system strengthening, focus must be shifted away from vertical interventions toward a holistic or horizontal approach. Then we move on to takeaways from the health financing workshops. We have that foreign aid has historically been used as a political tool. And the COVID-19 pandemic has shown the crucial need to prioritize and depoliticize health financing. The COVID-19 pandemic has shed light on the need for country investment in health systems. However, this will not be possible until we dismantle relationships of economic dependency on foreign countries through external debt repayments with strings attached and the overwhelming influence of foreign donors. There needs to be a move away from the for-profit model of global health interventions, seeking the return on investments, and towards less capitalist and Western-centric measures of success. And lastly, our generation of global health leaders has the power to change the colonial mentality that the public sector in low-income countries is inefficient or incapable of caring for their own populations. And now the takeaways from the education workshop. We must encourage learners and challenge our educators to employ more diverse and representative educational materials. We must increase policies that simplify and encourage equitable partnerships. There must be extreme transparency between global health partners and communities about their goals and benefits from their work in different countries. And instead of top-down guidelines, communities and their leaders can be more vocal about creating guidelines for their own context. Example, communities with similar situations can come up with context-specific guidelines. And lastly, we must assess global health initiatives at an institutional level critically and increase oversight for continuous improvement. And to close up, we have the takeaways from the research workshop. We must include local community members in research and critically think about who is offering expertise within communities. We need to raise awareness and educate local people and community leaders to improve the purpose of research in their communities. We must promote knowledge exchange and increase access to information, example, research and journals. And there needs to be an increased focus on implementation research, as well as an increase in the regulatory and ethics bodies in global health work. After the conference, we plan to compile these points into a more formal consensus statement that we can widely disseminate. And now I'll hand over to Didier and Minnie to give the closing remarks.
Thank you again for taking the time to engage with this work. The Decolonizing Global Health movement is an ongoing process that requires collaboration, activism, and continual learning and learning. We hope that we can take what we've heard and discussed today into our own practices and continue these conversations in our respective spheres and beyond.
And to close, we want to acknowledge the following groups and individuals without whom this conference would not have been possible. So on behalf of our group of organizers from the University of Rwanda and from Johns Hopkins University School of Medicine, we would like to thank our faculty advisors for this conference, Drs. Grace Chen and Bhakti Hansodi, also the Johns Hopkins Center for Global Health and the School of Medicine IT department for their technical support, all of our workshop facilitators who volunteered their time to lead discussions today, and various student leaders from around the world, including the International Federation of Medical Students Association, IFMSA, for their input and for helping us publicize. In addition, other Decolonizing Global Health groups, including those at Harvard University, Karolinska Institute, London School of Hygiene and Tropical Medicine, and the Decolonizing the Medical Curriculum Working Group, who have provided their support and guidance. And finally, we thank our attendees for your engagement and excitement about decolonizing global health. We are very excited to continue working with you all, and we'll follow up with information on how to stay involved and how to connect with other groups of students who are advancing this movement. Thank you, and we hope that everyone stays safe and stays energized for the long road ahead. And for those of you who are wondering, all recordings from today will be posted on our social media channels so that you can rewatch. Thank you all.
Thank you.